Welcome back to a special gross anatomy edition of The Doctors. It's natural to want to keep an unpleasant body problem a secret, so we applaud everyone willing to confront their stuff today, especially anything below the belt.
My name is Shelly. I'm 35 years old. I suffer from hemorrhoids and anal fissures. The first time I saw the bleeding, it was scary. I didn't know what was going on with my body. The pain that they've caused is severe. The worst point, I can remember I called my job and told them that I wasn't coming and I didn't know when I would be in. And all I could do was just sit on my living room floor and just cry because I didn't know what to do.
Hi.
Hi.
I'm Dr. Rodriguez. How are you?
I'm Shelly. Nice to meet you.
Oh, how you doing, Shelly?
I'm doing okay.
Nah, nobody's okay when they come to see the doctor, right? So, what brings you in to see me?
Well, I've been having some issues with constipation, bloating, a little bit of anal bleeding.
A little bit. There's no such thing as a little bit of anal bleeding. You know, it's scary.
Yes, it is.
Now, how long have you had the bleeding?
For about, off and on for about a year.
Wow, that's a long time.
Yes.
What have other doctors told you?
They just diagnosed me with having hemorrhoids and told me to use like the over-the-counter medicines and prescribe suppositories.
Okay, for a year, that's a long time. All right, let me ask you something. When do you bleed? When does it happen?
When I try to go take a bowel movement.
Okay, and your bowel movements, are they difficult to do?
Yes, I'm extremely constipated at sometimes.
How bad is the constipation?
Oh, really bad. Some days I don't want to get out the bed to do anything.
You're almost like bedridden because the pain is so bad?
Yes, yes.
That's unusual for hemorrhoids to be that painful.
The last diagnosis was anal fissures.
Okay, now we're talking about a completely different animal. Imagine you have a paper cut, you know, in your hand. Well, the same thing in the anus. It's a round muscle.
Right.
And when you're trying to force something through that, you know, like hard stool, and you can't, it just tears, and that hurts all the time. You got to remember that an open wound there, and every time you have a bowel movement, stool is bacteria.
Yes.
So it infects it, so it keeps it open all the time. Did you do anything to help your symptoms?
I totally changed my eating habits, incorporated more fiber. It helped a lot. I lost weight, so.
How much weight?
About 100 pounds.
100 pounds?
Yes.
Wow. All right. So it helped in many ways.
Yes.
You know what? This is probably fissures, but it's lasted for so long that I really need to do an anal examination and also a colonoscopy to see whether there's something in your colon that might be irritating that. Yeah, I saw that face. What's up with that?
I've been dreading it because I've heard it's painful, or I don't know, I'm just scared.
No, listen,
so.
a colonoscopy is really nothing more, in my opinion, right, than to actually look inside the colon. So we're going to have you prep the day before, clean your colon out of all the stool, because I need to see all the walls of the colonoscopy. And then when you're good and sedated and you're completely, you know, asleep, so you're not going to feel any of this, we're going to insert a tube that I can see with fiber optics and high-def cameras, and we're going to be looking at the whole colon. So when I'm done, there's not going to be any question as to what's going on.
Okay.
All right? And if it all looks good, then you'll have a lot of reassurance and you'll feel better. All right?
Yeah, that sounds better.
Okay, good.
We'll go for that.
Did you eat or drink anything this morning?
Well, this morning I did. I had a little bit of water.
There must have been some misunderstanding then between us, because you're not supposed to drink anything the day of the procedure. You may get nauseated and you may vomit. Now, you've also had asthma, so let me listen to your lungs. I'm going to take a deep breath through your mouth. Those lungs do not sound good. So we're going to reschedule the colonoscopy.
I'm going to cry.
What is the worst thing that you think we might find?
I don't know, maybe cancer or something.
Okay. Oh, baby, don't crawl.
Okay.
Is there somebody in the family that's had cancer of the colon or cancer?
My grandma.
So that's another reason, as scary as it is, to have the colonoscopy done. Give me a hug, give me a hug. Okay.
Thank you.
You're welcome. Let's just get this done. Get it out of the way. Let's give you some peace of mind.
All right.
All right? Shelly now realizes how important it is to get past that fear and investigate, because the best potential treatment for colon cancer is to catch it early so that it can be removed.